The health truth about masturbation in old age no one talks about. This probably won't come up at your typical doctor's appointment, but let's not dance around it. If you've stopped masturbating as you've gotten older, your body might already be showing signs of decline, and you may not even realize it. This isn't some awkward topic or locker room exaggeration. This is medical fact, grounded in decades of research. And the risks of ignoring this truth go far beyond sexual health. They can affect your mind, your sleep, your immunity, and even your connection to your own identity. I'm Dr. Edward Lane, a urologist and aging wellness specialist with more than 30 years of experience working with older adults across the country. Throughout my career, I've focused on the changing dynamics of intimacy, hormone balance, and long-term health in later life. One pattern I see far too often is this. Older adults quietly disengage from their sexual selves often, thinking it's no longer important without realizing they're letting go of something vital to their overall well-being. Here's what most people don't understand. Masturbation isn't a youthful habit you're supposed to outgrow. It's one of the few natural, accessible ways your body still has to regulate hormones, clear out stress, support organ function, and even protect mental health. If you've stopped or never really started, there could be real, measurable consequences affecting your quality of life. In just a few minutes, I'm going to explain what actually happens inside your body when you stop masturbating as you age. What I share might challenge some old beliefs, but it could also shift the way you think about your health and how you treat yourself in this chapter of life. If living with energy, clarity, and independence matters to you, make sure to subscribe and turn on notifications. This channel is all about helping older adults thrive. And if what I'm saying speaks to you, drop a 1 in the comments. If not, type 0. Your input helps shape future content that supports real needs. When I first started in urology, I never expected so many older men to bring up such a personal topic, but over time, I came to understand just how important it really is. I remember one patient in particular, named Harold, who told me during a routine visit, "I just assumed that part of my life was over." He was 72, healthy, mentally sharp, but he'd been waking up 4, sometimes 5 times a night to urinate, and he didn't understand why. What Harold didn't know, and what many men still don't, is that regular ejaculation, even through solo stimulation, is essential for maintaining good prostate health. It helps clear out old fluids, improves circulation in the pelvic area, and can actually ease urinary issues that tend to show up with age. Without it, the prostate can become congested, inflamed, and less efficient, leading to all kinds of sleep-disrupting and confidence-shaking symptoms. The prostate isn't some dormant part of the body, it's an active, responsive organ with real demands. It produces essential fluid, flexes, and shifts, and like any system in the body, it starts to struggle when ignored. Without consistent release, particularly through ejaculation, prostate fluid can begin to pool and stagnate. That buildup becomes a breeding ground for inflammation and swelling, which over time can interfere with everything from urination to sexual function. You might notice it as a lingering pressure, a weaker urine stream, or an uncomfortable sensation that never fully goes away. These may seem like minor annoyances, but they're not. They're your body waving a red flag. Over time, this stagnation can lead to a very common yet avoidable condition: benign prostatic hyperplasia, or BPH. Nearly half of all men over 60 develop it, and if left unchecked, it can progress to serious issues like urinary blockages, bladder infections, or the need for a catheter. That same gentleman I mentioned earlier, Harold, ended up needing surgery to relieve the pressure. But in truth, if we had addressed the issue earlier through something as basic as regular self-stimulation, that outcome might have been entirely preventable. Simple, steady habits like masturbation help clear the gland, refresh the fluid, and reduce the chance of buildup. In fact, research suggests that men who ejaculate 21 times or more per month have a significantly reduced risk of developing prostate cancer compared to those who don't. And let's be clear, this isn't about trying to reclaim your youth or turning to fantasy. It's about functionality. It's about honoring the systems in your body that still work and keeping them working. Choosing to abstain in older age doesn't just reduce pleasure, it increases your risk of pain, dysfunction, and the slow erosion of control over something as fundamental as urination. I've cared for patients who began avoiding travel, social gatherings, even simple errands because they didn't trust their bladder. Men who once stood tall and independent now lie awake at night, anxious and sleep-deprived, trapped in a cycle of discomfort and unpredictability. And that doesn't just impact the body, it eats away at the spirit. Because when your bladder controls your schedule, your freedom slips away too. But the consequences don't stop in the lower half of the body. What happens in the prostate doesn't stay there. In fact, when sexual release disappears from your routine, the effects can travel all the way to your brain and the results can be startling. Let's take a look at what happens to your mental clarity and memory when you go without regular self-stimulation for long periods. If you're still with me and this message is hitting home, go ahead and type 1 in the comments. It lets me know that this conversation matters, and that you're ready to keep learning how to protect both your body and your mind. Now, let's continue with point number 2. Not long ago, a gentleman in his late 60s came into my office, not because of prostate concerns or low energy, but because of something subtler. He sat down, looked at me and said, "Dr. Lane, I just don't feel like myself anymore. I'll walk into the kitchen and forget why I'm there. I start a sentence and can't finish it. I used to be sharp, now I feel like I'm slipping. Is this just part of getting old?" It's a question I've heard more times than I can count. And while it's true that aging brings changes to how the brain works, what most people don't realize, including those who are thoughtful about their health, is that sexual activity, including solo touch, plays a surprisingly important role in keeping the mind sharp. Here's what happens when you engage in self-stimulation. Your brain floods with powerful neurotransmitters, dopamine, serotonin, and oxytocin among them. These aren't just feel-good chemicals, they directly support memory, attention, and emotional stability. They encourage blood flow to the brain, strengthen neural pathways, and lower cortisol levels, the stress hormone that, in excess, actually harms brain cells. But when you stop this kind of activity, especially over months or years, your brain misses out on these natural boosts, and that absence starts to show, not all at once, but gradually. Focus fades. Names slip away. The spark that once fueled conversation or creativity begins to dim. Before long, many people begin to doubt themselves. They worry something's seriously wrong. That doubt opens the door to something deeper: fear. I've seen older adults spiral into anxiety or low mood simply because their brains were missing the stimulation and hormonal balance they once took for granted. For men especially, there's another layer: testosterone. This hormone isn't just about sex drive, it supports memory, drive, and confidence. And without regular sexual activity, testosterone levels can drop more quickly, speeding up the decline in mental clarity and emotional strength. Some emerging studies even suggest that lower sexual engagement in older adults may correlate with earlier cognitive decline, even the beginnings of dementia. Now, to be clear, I'm not saying that giving up masturbation causes Alzheimer's, but I am saying this: when the brain is deprived of the chemical surges and emotional regulation that come with physical intimacy, it becomes more vulnerable, it slows down, it stiffens, and the fog can become thick enough to reshape how you think, how you function, and how you relate to the world. I remember one man, a lifelong chess player, who stopped going to his weekly game nights because he just couldn't think straight anymore. Another, a retired English teacher, told me he sat in front of the newspaper each morning and felt completely blank. These weren't conditions requiring medication, they were signals of a life that had drifted too far from connection and self-care. And here's the hardest part: it doesn't have to be this way. You don't need a prescription, you don't need expensive supplements, you simply need to reconnect with yourself. Sometimes, healing starts with something simple: reestablishing a relationship with your own body, acknowledging the quiet need for connection that doesn't disappear with age. Because while mental fog can creep in slowly, emotional imbalance often follows even more subtly. When we stop nurturing physical intimacy, especially with ourselves, it's not just clarity that fades, or emotional resilience begins to wear thin too. And many don't realize it until they're already in the middle of it. Let me tell you about Charles, a 72-year-old retired architect and widower. He came in one afternoon and sat silently for a long moment before saying, "I don't feel anything anymore, not sadness, not happiness, just nothing." Then he asked the question I hear all too often, "Is this just what getting older feels like?" That moment stuck with me, because what many chalk up to aging, the emotional dullness, the sense of drifting, the fading excitement for everyday life, is often rooted in something deeper. And one of the biggest, yet most overlooked contributors is the quiet disappearance of self-intimacy. Here's what many people don't realize. Masturbation isn't just physical, it's emotional. It activates the body's natural chemical response to stress, loneliness, and isolation. During orgasm, the brain releases endorphins and oxytocin chemicals that naturally boost mood, reduce anxiety, and foster a sense of calm connection. These are not trivial, they are protective. But when self-pleasure fades away, especially during a season of grief, loneliness, or major life change, your body loses one of its simplest built-in ways to regulate mood. Emotional flatness begins to settle in. Then come the deeper shifts. Reduced interest in things you once enjoyed, trouble sleeping, changes in eating habits, or simply losing the desire to connect. Life begins to lose color. And the saddest part? Most people don't see the link. They think they're just getting older. They believe their emotional fade is inevitable. But what they're really experiencing is disconnection from themselves. Depression in older adults often doesn't look like we expect. It may not show up as tears or sadness. It might look more like exhaustion, irritability, withdrawal, or a quiet disinterest in daily life. It can be mistaken for slowing down, when it's actually a system-wide response to lost intimacy. Of course, medication and talk therapy have their place. But I've witnessed powerful shifts in patients who simply began to reconnect with their own bodies. One man, a retired teacher in his late 70s, told me, "I started touching myself again, not out of desire, but because I wanted to feel something. And within a week, it was like my spirit came back online." He smiled, leaned in, and said, "I remembered I was still a person, not just a passenger." And that's exactly the point. This isn't just about pleasure, it's about preservation. About remembering you still deserve to feel. You still deserve to be here, fully. And that's what I hope you'll take away from this. Masturbation in later life isn't about fantasy, lust, or embarrassment. It's about emotional regulation. It's about giving your body permission to feel, to release, and to remember what it means to be fully present in the moment. Because when that physical connection is lost, you're not just opening the door to sadness, you're also inviting an emotional withdrawal, isolation, and in some cases, the quiet loss of interest in life itself. But the emotional consequences are just one part of the picture. As night falls and your sleep becomes fragmented or shallow, another impact begins to surface, one that touches everything from your memory and immune system to your long-term health. Let's talk about how the absence of sexual release might be quietly robbing you of the deep, restorative sleep your body needs more than ever. If this resonates with you so far, take a moment to type 1 in the comments. It helps me know you're still with me. Now, let's deviate into point number 4. I once worked with a man named Martin in his late 60s. He came to me after months of struggling with his sleep. He looked tired, almost translucent, and he told me, "Doc, I fall asleep fine, but like clockwork, I'm wide awake by 2 a.m. And then I just lie there completely alert, staring at the ceiling, waiting for the sun to rise." We ran the usual tests, checked his breathing, ran blood work, reviewed medications. Everything came back normal, no obvious cause. But when I gently asked about his intimate life, he looked away and said softly, "That part of me doesn't exist anymore." But maybe that was exactly the part his body was missing. Because here's the thing. Sleep isn't just about rest, it's a carefully choreographed biological process. And one of the body's most natural signals for that process? Orgasm. During climax, the body releases a calming blend of chemicals, oxytocin, prolactin, and endorphins, all of which are designed to shift the nervous system from alert to restful. At the same time, Cortisol, the stress hormone that keeps you awake, and tense drops sharply. Your heart rate slows, your muscles soften, your mind drifts. Now imagine removing that signal from your routine, not just now and then, but for months or even years. That's exactly what happens when older adults stop engaging in solo intimacy. The body loses a reliable, powerful sleep aid it once depended on. And what takes its place? For many, it's racing thoughts, tossing and turning, and a creeping sense of frustration. Some reach for sleep medications. Others just come to accept exhaustion as part of aging. But make no mistake, poor sleep is more than an inconvenience. Chronic sleep disruption wears down the immune system, speeds up memory loss, increases the risk of heart disease, and amplifies feelings of anxiety and low mood. In other words, it doesn't just make you tired, it puts your entire system under stress. The solution doesn't always lie in a pill. Sometimes it's as simple and natural as returning to a part of yourself you thought you had outgrown, but your body still deeply needs: sleep and self-renewal. In older adults, poor sleep isn't just about daytime drowsiness. It's directly linked to falls, memory decline, and gradual loss of independence. I've watched patients who were once active and vibrant slowly retreat from life, not because of a disease, but because exhaustion made everything feel too hard. And the heartbreaking truth? Many of them had no idea they were missing something their bodies use to count on, not a prescription, not a gadget, but their own natural release. Masturbation may seem like a small, even insignificant act, but for some people, it's the difference between a restless night and deep, uninterrupted rest. One man in his 70s told me after reintroducing self-touch, "I sleep like I did in my 40s. I didn't know how much my body missed that release. I thought this was just aging." That's the core misunderstanding. Too many older adults confuse biological neglect with the symptoms of aging and quietly suffer as a result. So if you find yourself lying in bed, unable to relax, staring at the ceiling with your thoughts running wild, ask yourself, when was the last time your body truly let go? Sometimes the fix isn't in a pill bottle or a meditation app. Sometimes it's about reclaiming a rhythm your body still remembers if you'll allow it. As sleep begins to erode your energy and focus, another shift is often happening beneath the surface, one that's far more physical. It shows up in how your muscles feel, how your posture changes, and how your control over your bladder begins to slip. Let's talk about what happens to your pelvic floor and blood flow when physical intimacy fades away. A few years ago, I met James, a retired firefighter in his early 70s. Built strong from a lifetime of physical labor, he came in with a quiet concern: mild urine leakage and discomfort standing for more than 10 minutes at a time. "I don't know how to explain it," he said. "It feels like the base of my body is starting to crumble." What James was experiencing wasn't just age, it was a subtle but real decline in pelvic floor strength. And he's far from the only one. The pelvic floor is a web of muscles that support your lower organs. Your bladder, bowels, and sexual function all rely on it. Most people never think about these muscles until something starts to go wrong. Unexpected leaks, chronic constipation, erectile issues, or discomfort in the hips and lower back. What's rarely discussed is this: regular sexual activity, including masturbation, actually helps maintain these muscles. During arousal and orgasm, your pelvic floor goes through rhythmic contractions, mini workouts that promote blood flow, keep tissue elastic, and help nerve signals remain sharp. It's not about performance or desire, it's about maintaining the foundation of your body. When stimulation disappears from your life, those muscles begin to weaken. Circulation slows, tissues lose tone, nerve signals start to dull. Over time, this can lead to more than just inconvenience. It can affect your ability to move freely, to feel confident in your body, and even to stay upright without discomfort. And because it happens so gradually, many people don't notice until it's already affecting their daily life. And eventually, the symptoms start adding up: frequent, urgent trips to the bathroom, a bit of leakage after urinating, trouble holding in gas, discomfort, or even pain during basic movements. For men, this might mean a sharp decline in sexual performance. For women, it can manifest as dryness, tightness, or discomfort that makes intimacy feel more stressful than soothing. I've watched Older adult aunts, confident and socially active, begin declining invitations or avoiding trips simply because they can't trust their bladder anymore. Some describe sudden leaks when laughing or sneezing, without realizing that what's happening isn't just aging. It's the result of years of reduced circulation and muscle inactivity in the pelvic region. And I want to say this plainly. Ignoring your pelvic health doesn't just lead to frustration, it can result in falls, chronic incontinence, and a loss of dignity no one should have to endure. You may start depending on pads, specialized clothing, or planning your day around the nearest restroom. All because your body's foundation, the muscles that hold everything in place, is quietly weakened from lack of stimulation. What truly breaks my heart is how many suffer silently, too embarrassed to ask, too convinced it's just how things go. But I need you to hear this. Your body is still capable, at 70, at 80, even beyond. And one of the most effective, natural ways to support that capability without medication or surgeries through consistent, safe, physical intimacy with yourself. Reconnecting in this way isn't just about pleasure. It's about reactivating strength. It's about sending fresh blood to the places that need it, about keeping nerve endings awake, tissues supple, and the lower half of your body alive and responsive. You're not just touching your body, you're reminding it that it still belongs to you. But as important as circulation and muscle tone are, the next consequence goes even deeper into your immune system, into the very defenses your body depends on to fight infection, inflammation, and chronic disease. Because what happens in your bloodstream after orgasm might be one of the most overlooked benefits of all. Let's talk about how a lack of sexual activity, even solo, might be weakening your body's ability to stay healthy. I remember one winter a few years back, a longtime patient of mine came in looking worn down. His name was Walter, in his late 60s, and normally he was sharp and vibrant. But that season, he'd been sick 3 separate times, minor colds that dragged on for weeks, a sinus infection that just wouldn't clear, and a deep fatigue that hung over him like fog. I used to bounce back after a day or two, he told me. Now, it's like everything hits harder and takes longer to shake. We checked his labs. His nutrition was fine. His sleep was okay. No new medications. And then I asked a softer question. Walter, have you been sexually active lately, even by yourself? He chuckled awkwardly and said, No, doc, that part of me's been retired a while. What he didn't realize, and what many people overlook, is that sexual activity has a direct influence on immune health. And I don't mean metaphorically, I mean biologically. It's measurable. During moments of arousal, especially orgasm, your body doesn't just experience a wave of pleasure. It also unleashes a surge of biochemical messengers that play a powerful role in protecting your health. Yes, there's dopamine and oxytocin, which boost mood and connection, but the benefits go much deeper. One key immune booster, immunoglobulin A, or EGAA, critical antibody that defends your respiratory and digestive systems from infection. Alongside IgA, your body also produces endorphins, natural anti-inflammatory agents that not only reduce pain, but support healing and resilience. These are real, measurable changes in your internal environment, and they don't come from a bottle, they come from within you. Now imagine going without that internal boost, not just for a few days, but for years. That's what happens when you give up sexual release. Your immune system, already slowing down with age, loses one of its easiest, most natural reinforcements. It's like removing the batteries from your smoke alarm. You won't notice it right away, but when something goes wrong, your body simply isn't prepared to respond. Over my decades of clinical experience, I've seen this over and over. Older adults who've stopped engaging in any form of intimacy often find themselves getting sick more frequently. They take longer to recover from common colds. Minor infections seem to linger, and while many don't connect the dots, their bodies are sounding an alarm. Something important is missing. But here's what's even more crucial. Your immune system isn't just about fighting off seasonal illness. It's deeply connected to long-term wellness. From how your body keeps cancer cells in check, to how wounds heal, to how your heart and brain stay healthy over time. When you stop nurturing this part of yourself, the domino effect is real. Stress builds, sleep suffers, inflammation increases, and your body starts to run slower, weaker, and more vulnerable than it needs to be. And yet, the solution is so often overlooked, not because it's out of reach, but because people feel embarrassed, unsure, or assume it's too late. But I promise you, it's not. I remember a woman in her early 70s who had completely stopped touching herself after losing her husband. She told me, "I figured that part of life was over." But after we spoke about the connection between immune strength and self-intimacy, she decided to try again, not for pleasure, but for wellness. A few months later, she came back to my office glowing. "I feel more alive," she said, "like my body's finally working with menet against me." That's not magic. That's biology. Your immune system doesn't care about social norms or shame. It only responds to action. And the simplest action you can take? Reconnecting with your body in an intentional, caring, and physical way. Because when you stimulate your body even gently, you send a message through every cell. We're still here. We still want to thrive. And when you stop responding to your body's quiet signals, you don't just increase your risk for illness, you risk disconnecting from yourself. You stop feeling like you belong in your own skin. That loss isn't just physical, it's emotional, it's spiritual, it's about identity. He came in for just a routine checkup. Nothing urgent, nothing specific, just a regular visit. But something about him felt different. His shoulders were slightly slumped. His voice was quieter. And when we sat down to talk, he looked at me and said, "I don't really feel like I live in this body anymore. I feel like I'm just occupying it." That moment has stayed with me because over the years, I've heard versions of that same confession from many older adults, both men and women. And while the words may vary, the message is always the same. Somewhere along the way, they stopped feeling at home in their own skin. More often than not, this disconnection begins silently. A quiet decision to stop engaging with the body in an intimate, nurturing way. Sometimes it's framed as unnecessary. Sometimes it's dismissed as something I've outgrown. But when we stop touching our bodies, not out of desire, but out of presence, we begin a subtle process of separation. A slow, quiet drift away from ourselves. Because self-touch isn't just about pleasure, it's about awareness. When you take a moment to connect with your own body even softly, even without an agenda, you're sending your nervous system a powerful signal. I am here. I still exist. This body still matters. But without that connection, something internal begins to shift. You may stop noticing little aches, stop looking in mirrors, stop treating your body as something worth caring for. And that, in my experience, is one of the most dangerous losses that aging can bring, the loss of self-worth. Over time, I've seen this internal distancing lead to deep emotional dullness. People stop moving with intention, stop preparing meals with care, stop dressing in a way that makes them feel like themselves. Why bother, they think, when this body doesn't feel like mine anymore? One woman, in her late 60s, once told me, "I haven't touched myself since menopause. I just didn't feel like a woman anymore." Then she paused and said something I'll never forget. "The less I touched myself, the more I disappeared." That word "disappeared" echoes in me, because it captures exactly what happens when physical disconnection becomes emotional absence. You don't just lose sensation, you lose identity, presence, life. But here's what I need you to know: it doesn't have to be that way. Reconnecting with your body through gentle, respectful self-touch isn't about chasing old desires. It's about honoring the life that still exists within you. It's about saying, "I'm still here. I still feel. I still deserve to be seen, even if only by myself." And when you begin that process, even privately, even slowly, you're not just reclaiming sensation, you're reclaiming yourself. You're sending a message that aging does not mean disappearing, that your value didn't vanish with your youth, that you are still worthy of care, connection, and comfort. This, perhaps, is the quietest and most powerful form of healing we can offer ourselves. Each of the 7 consequences we've explored is serious on its own, but taken together, they reveal something even more urgent, a deeper truth about aging that rarely gets spoken aloud. This final message is not just about awareness, it's about empowerment. I want to show you what's truly at stake, and more importantly, how you can begin to reclaim control starting right now. Looking back on my years caring for older adults, what stands out most isn't just the illnesses or diagnoses, it's the quiet, private losses people carry. Losses that don't show up in blood tests. A man who once walked tall now avoids looking in the mirror. A woman who once lit up every room confesses she hasn't truly felt anything in years. Too often, they're told this is just part of aging. But I don't buy that. And if you've stayed with me this far, I suspect you don't either. Because here's the truth. The moment you stop tending to your sexual self, the moment that part of you is dismissed or abandoned, a chain of quiet consequences begins. Not because you've aged, but because you've stopped sending the body the signals that say, I still matter. Throughout this journey, we've looked at how the body responds when regular intimacy disappears. Prostate issues, foggy thinking, depression, restless nights, weakened muscles, immune vulnerabilities. But maybe the hardest loss to name is this: when you disconnect from your body, you begin to lose your sense of self, and that slow unraveling can make you feel like a stranger in your own skin. These aren't just side effects of getting older, they're signals. Your body, your heart, and your identity are asking for attention. These changes don't mean it's time to give up. They mean it's time to lean in. I've sat across from patients who felt hollow and cut off from themselves. But I've also seen what happens when they begin to reconnect, when they choose, in their own quiet way, to reclaim their bodies. It doesn't take another person. It doesn't require youth or perfect health. What it takes is permission your own to see yourself as still worthy of care, connection, and yes, pleasure. I know this is not an easy topic. For many, it's uncomfortable. For some, it's never even been talked about out loud. But as someone who's walked this road with thousands of men and women, let me say this clearly. Caring for your sexual health in later life isn't strange, it's essential. Masturbation in older adulthood isn't about indulgence. It's about keeping your blood flowing, your hormones balanced, your mood lifted, your defenses strong, and your sense of self intact. It's not just a pleasure, it's a practice of care. A simple yet powerful declaration that you're still here, still alive, and still taking responsibility for your well-being. One of my patients once told me, I didn't realize how much I missed feeling like myself until I finally touched that part of me again. That moment wasn't about fantasy. It was about coming home. And that, more than anything, is what I hope this conversation brings you, a path back to yourself. This isn't just about staying alive, it's about being alive, fully. It's about inhabiting your years with presence, dignity, and a quiet joy that still belongs to you. If you've pushed this part of yourself aside, buried it in shame, or forgotten it entirely, I'm gently inviting you to come back, to remember that your body is still paying attention, it's still capable, and it is still worthy of care. You don't need to make a bold move. You don't need a plan. Just begin gently, with curiosity, with kindness. Give yourself permission to reconnect at your own pace. Because when you start caring for this part of yourself again, you're not just improving your health, you're taking back something far more precious. Your sense of vitality, your sense of self. If something in this message has touched you, if it made you pause, reflect, or feel seen, please don't keep it to yourself. Share it. Someone else may be quietly struggling, just as you were. And if you feel comfortable, leave a comment below. Whether you agree, disagree, or have a story of your own, your voice matters. You never know who might feel less alone because you chose to speak.